My name is Katie Wolf. I'm a freshman student nurse, and today I'm going to be doing the initiation of the IV. So the first thing we want to do is we're admitting the patient for rehydration and antibiotic therapy. That's in the MAR, or the physician's orders. And so also in the physician's orders are to initiate an IV, 1,000 milliliters of 0.9% normal saline, and it's going to infuse over 6 hours. So when we do that, before administration to the patient, we would want to check the 6 rights and then get our bag ready. So called for 0.9% sodium chloride, check the bag for any particles, and you would also choose the continue flow solution set. It's got a drop factor of 10, so that would make it 166.7 milliliters per hour, or 27.8 drops per minute. So we'll just keep that in mind when we're setting it up. Expiration's good. Keep this sterile. And we would want to make sure this is off, but then we would go to prime the tubing. Want that about halfway. And then so for our drop factor, we would want it 27.8 drops per minute, or 7 drops every 15 seconds. And once we get that right, we would just do this clamp, so we don't have to adjust the roller clamp anymore. So it's already labeled 0.9% sodium chloride, but we would want to put like a little tag on it that says when to change it. And then we would want the patient name on there too, and the expiration date. So just put it on there like this. Do is come into the patient room, make sure that you get your 2 patient identifiers, educate the patient on why we're doing the IV therapy, make sure that they are comfortable and they are understanding what's going on. So kind of find the vein we want. Make sure that we have a pulse. If there's no pulse, you'd have to loosen this up. Make sure that your vein is distending back up after you compress it. So I chose a 20 gauge IV. We just want to make sure not to block the site where you're looking. Put this underneath. Or where you would need to look. So you want to date initial, and then you want to do the gauge of the IV, which is 20. And then just flush it and make sure that it's running. Probably should have taken that off after I got the IV in. So everything is running fine on the IV. So now we would want to hook up our IV tubing. We want to make sure that we clean this little hub. Make sure that our drop factor is good, which I already set that up earlier. So all we're gonna need to do is just push that over. So just push this in, hook it up. Open this. Make sure that we are getting fluid dropped in, and it looks like we are. So we would want to make sure that this tubing is taped out of the way of the patient, so they're not going to get it caught on anything. We want to inform them of signs of infection, pain, redness, heat at the injection site, and then we want to lower their bed, make sure they're comfortable, put their collate close to them, and just monitor the drop rate every hour, and that's it.